Hello and welcome. So today's topic is our sclera, as you can see in this photo. Now, as I said in my earlier videos, that the sclera is the part of the outer layer, which is basically the 5/6 portion of the outer layer or the fibrous coat of the entire eyeball. Now, this eyeball has superior part, inferior part, medial part, lateral part, posterior part. All these parts are covered by Tenon's capsule except the anterior area. I mean, this anterior area, this whitish part, you can see upside, downside, right side, left side, I mean the lateral side, medial side. This entire whitish part or this anterior part of the sclera is covered by conjunctiva. Rest of the entire sclera of the entire eyeball is covered by Tenon's capsule. Remember this point. Now the thickness, which depends or varies from age to age, I mean young to adults, and also person to person, male to female, but you have to understand or you have to remember the average thickness or the measurements. Suppose at the limbus, I mean the sclerocorneal junction, the thickness of this sclera is almost 0.8 millimeter. At the anterior to the rectus muscle, it is 0.6 millimeter thick, and posterior to this rectus muscle, it is 0.3 millimeter thick. Now, I already talked about these rectus muscles and oblique muscles in my very earlier videos. You can check those. At the equator, it is 0.5 to 0.8 millimeter thick, and to the posterior part, it is almost 1 to 1.2 millimeter thick. So, the posterior portion of the sclera, it is the thickest. Now, you have to understand the entire sclera is pierced by 3 sets of apparatus. First of all, you have to know that posterior apparatus, which consists of optic nerve, short and long ciliary nerves and ciliary vessels. Okay. Middle apparatus, which consists of 4 vortex veins. These vortex veins are also known as vena vorticus. Now at this point you have to understand that this blood supply of this sclera is done by these short and long ciliary vessels and the vena vorticus or the vortex veins. That's it. And thirdly, the anterior apparatus, which consists of anterior ciliary vessels and the branches of long ciliary nerve. That's it. Now the microscopic structure or the microanatomy of the sclera, you have to understand that it has basically 3 layers. First of all, episcleral tissue layer, which is consist of, it is basically thin and condensed vascularized layer of the connective tissue which forms or which covers the entire sclera, and it consists of fine fibroblast, macrophages and lymphocytes. Secondly, you're going to find sclera proper, as you can see in this photo. So it is basically dense and it is avascular. There is no blood vessels, no lymphatic vessels, and the collagen fibers are densely interconnected in multidirectional way. That's why it is opaque and forms the white color. Okay. And lastly, the innermost layer of this sclera is lamina fusca. So it consists of brown color pigmented cells. Okay. Now the nerve supply of the sclera, it is basically supplied by the long ciliary nerves. That's it. See you in my next video. Till then, bye.